Hello, I'm Dr. Frances Pitsillis. More and more women, as they're getting older and more stressed, are getting problems with their premenstrual symptoms and heavy painful periods. And some of these problems are occurring a little younger in age than perhaps they used to. This condition is called estrogen dominance, and this is because normally there would be a predominance of progesterone as compared with estrogen in the second half of the cycle. But now, because the progesterone is diminishing along with estrogen when you're premenopausal, or the progesterone is being drained by chronic stress, you're getting estrogen dominance, which is not enough progesterone in the second half of your cycle. Now, this will occur in everyday women, anything over the age of 35. Estrogen dominance can also occur in younger women with polycystic ovarian syndrome, endometriosis, and also the problem can contribute to fibroids in the uterus and fibrocystic breast disease. So the symptoms that these women get are a lot of premenstrual symptoms like breast tenderness, irritability, depression, irritable bowel, anxiety, inability to sleep, irritable bowel symptoms that extend to constipation and diarrhea and even acid reflux. Sometimes migraines start up. In addition, there are heavy painful periods because there hasn't been enough progesterone in the second half of the cycle to stabilise the lining of the uterus. So what can we do? Well, we have to deal with any underlying stress that's causing the problem. If someone's nearing menopause, we're going to do all of that, but also look at giving them micronized progesterone. In fact, we can give the younger women micronized progesterone safely as well. We're going to also correct zinc and magnesium, which are involved in the periods and the cycles. And we're going to give the general multivitamin and the fish oil and correct all our other deficiencies. Now, this is what I would do. Onwards from that, if what I am suggesting doesn't work, conventional medicine gives us some good tools. Conventional medicine suggests micronized progesterone, but also there is cyclocapron, which is a prostaglandin inhibitor that reduces the bleeding. The only problem is that the cyclocapron doesn't help the premenstrual symptoms. This is where I think the micronized progesterone is better because it gets both problems. I'm hopeful that being able to use hormonal and general nutritional support is going to help some of the ultimate outcomes that occasionally occur, which is hysterectomy, and this is in women who end up with periods that are so heavy that they just don't tolerate it anymore. So my advice to women with these problems is the following. Be in bed and asleep by 10:30 so that you can get a good restful sleep and your body makes melatonin, which is restorative. Manage your stress because that causes reduced production of progesterone from the adrenal glands. The progesterone that's produced from your adrenal glands calms you, helps with fluid retention and breast tenderness, helps you sleep, so you can see the logic behind this. And we want people to think about the way they think. Do any relaxation techniques, counselling, rearrange your life, and don't work so hard. Have a diet with adequate protein in it and avoid sugar and starch. That's also going to help the carbohydrate and sugar cravings. Exercise regularly. Avoid too much coffee and alcohol if you're getting hot flushes because they drain magnesium. So you can take extra magnesium if you need to. I think it's important to follow all of my nutritional and supplement advice and ask your doctor if they can prescribe micronized progesterone for you. Micronized progesterone is the same as in your own body. It's not synthetic. The synthetic ones can damage your heart and are not as safe and carry with them an increased risk of breast cancer. Some people have asked whether using progesterone as a cream might be better. Well, I think if you're having sleep problems and you really have a serious problem with your PMT and your heavy painful periods, the capsules are going to work better than the cream because they have a stronger effect. In addition, the cream starts to accumulate in the fat of your skin, and then we never know what dose to adjust to after that. Now, what about wild yam cream, I've heard some people say? Well, the thing about wild yam cream is that the actual ingredient that comes out of it, diosgenin, cannot be changed into progesterone by your body from the wild yam cream. That's why they take the yams or the soybeans and they convert the diosgenin in a factory or a drug company and turn it into the micronized progesterone, which is the same as your own body. So the ultimate benefits by correcting your diet, getting some good sleep, and taking magnesium, zinc, fish oil and a multivitamin is going to be wonderful. And then if you bring in the progesterone, maybe before you try the cyclocapron and before you try the Mirena IUD and before you try surgery, consider micronized progesterone. It gives you so many benefits and is likely to help you avoid stronger treatments.